have this card, and it's a card from medicine. Now we have second encounter. Here, the patient is coming to you for second time. So what we can see that the doctor is here, like he's a 42-year-old patient with recent fasting blood sugar, right? And he confirmed a diagnosis of diabetes mellitus, let's say, type 2. And this is the patient's second test this month. So it means that he's coming to collect the report for second time. Again, regarding the age of the patient or the name of the patient, the age is being mentioned. Okay. So basically, we can see there, you can discuss the age and name of the patient right over here. And the patient is 42 years old and he's coming to see the reports for second time. So how can we start the card? We can start the card again with the name of the patient. Hello, after your brief introduction. Hello, I'm Dr. XYZ. Mr. Mark, please have a seat. So if I'm not wrong, today you're here to collect your blood test report, right? With the second encounter. So we have to start with the tagging question. Whenever the patient is coming to you for second time, we have to start with the basically tagging question. So what is the tagging question? We can answer the question like in this way. Hello, my name is Dr. XYZ. I'm the doctor over here. I can see that today you're here to collect your blood test report, right? So after that, you have to explore the patient expectation, like what it could be. So for that, we can ask two, three more questions. We do start in this way after greeting the patient with tagging question. So, Mr. Mark, I can see from your file that you have it's a second time, and the first time we have the same reading, as of today's, that is around 7.6 millimole. So, do you have any idea about this reading that what it could be? Then the patient might be telling you, I don't know, like what it could be. Then you can ask the patient. Basically, it means that your blood sugar levels are high on the higher side from the normal. So anything that's come to your mind, like what it indicate, like why are you having high blood sugar level? The patient might not tell you something over here, or might be telling you like I think that uh, it might be related to sugar eating. You can ask a question like, how about your sugar intake? So then the patient might tell you that I don't eat much sugar. Again, you have to ask the cross question. If you don't eat much sugar, then why do you think are you having? Then you have to explain. Basically, as per the test that has been conducted two times, this condition is called as a diabetes mellitus. So have you ever heard this term before? Then patient will tell you, well, yes, I have, or maybe I have not. Then explain him in the layman language. When explaining in the layman language, keeping because you have read the card, you can see that the patient challenges your diagnosis. So when explaining the diagnosis, it should be explained in this way that he might not give you tough time. So we can ask a question like you can explain the diabetes mellitus. Basically, this is the condition in which your blood sugar levels are on the higher side, as there is an organ in your body. Its function is to regulate the like amount of sugar that is being required by the your organs of the body. For example, if my heart, my kidneys, my brain, they're working, they need energy to perform. So in that regard, we can see that how can we handle. So we can see there we have to ask this question like like uh, in which your body need an extra amount of blood sugar levels. For example, your heart, brain, kidneys, they all need excessive amount of blood sugar. So this might be potentially damaging for your body. So this condition is called diabetes mellitus. Then the patient might ask you that you have conducted two tests. Then you have to show him again with this point that the threshold point actually as per the World Health Organization, it's a standard body. It's being proven by the research that this is the gold standard now. and we have been following this diagnostic criteria from the last many years. So let me show you that now this has a gold standard that has to be followed. Then you have to emphasize the patient. Like I can, it's totally understandable your concern. However, it's quite important for you to go for the early treatment and have the appointment on the regular basis so that their blood profile can be monitored along with the cholesterol and blood pressure. Okay, as I have mentioned earlier, that high blood sugar level might lead to the you can say damage to your organs, which might have consequences such as your heart, brain, your feet, your kidneys, and eyes would be affected if that blood sugar level would not be controlled early on. Okay, so then we can say, Mark, I have made myself clear. So don't worry, there are some plans to be followed. So if you allow me, can I discuss with you? Then we can discuss. Okay, we have to modify your diet that would be appropriate in view of your recent diagnosis. In addition to that, have some healthy lifestyle. And for that, I would like to refer you to dietitian or maybe the diabetic educator. Then the patient will again give you tough time, and you have to consult the patient that these are the preventive measures has to be followed. And as I mentioned, that the blood tests are being that we have done, they have confirmed the diagnosis. That's a gold standard. In addition, for going for any other tests for diagnosis is unnecessary. However, as I mentioned, that we'll go for the blood sugar profile. We will assess your blood sugar level on regular basis, and we'll see if there is any problem. Okay. So this is the way. Then you can close the card. Okay. Do you have any question? Okay. If you don't have any question, I'd like to summarize the card. Right.